Lumbago is only on your back.
Lumbago is only on your back, correct. Spondylosis is only on your spine. Anyone else?
Swelling and bone is if you rub your knee bones together.
Yeah, absolutely. So that's where the cartilage is completely gone. In the grand scheme of things, the point I was making is, generally speaking, the actual process that happens here is exactly the same. Okay? So you hear some people go, I've got osteoarthritis, other people say, I've got bone on bone. In the grand scheme of things, they're exactly the same thing. Okay? Rheumatism is a very old-fashioned word that people used to use for wear and tear and arthritis. And lumbago, again, is just off the back, like you said, of the lumbar spine, sorry?
Well, spondylosis.
Spondylosis is a combination, it's wear and tear of the spine. Okay, SP being the spine, spondylosis, osis means wear off, degenerative. Okay, so as you get older, it gets worse. So you can have spondylosis of the neck, of the mid back, and the lower back. Okay, but in the grand scheme of things, it's also osteoarthritis, it's also wear and tear. Okay, and chances are there's some bone on bone in there as well. Okay, so I'm touching on all of that today. So I've picked a knee joint for an example. So it's a nice big joint, it's easy to look at. So this is the process that we go through with what we call wear and tear or osteoarthritis. There's 4 stages. Stage 1, you're 15, your knee's beautiful, no problems whatsoever. Depending on the amount of activity you do, depending on your diet, depending on everything else, will depend on how this process occurs. Okay? So it starts off where, as you can see, this little coating on the outside of the knee. So this is your right knee, and that little blue bit is your cartilage. The cartilage cracks and starts splintering off. Now, the reason why this does this is your cartilage pad is like a big sponge. Okay? In the joint, it's full of fluid, like a lubricant, like WD-40 on a hinge. Okay? That sponge fills up with water. Every time you take a step, the sponge squeezes all the fluid into the joint. That joint then gets lubricated. You have a nice, smooth moving joint. As we get older, that sponge becomes less efficient at reabsorbing that water. So the edges become a little bit brittle, okay, like a dry sponge. And sometimes they can just begin to splinter, okay? This is a very natural process that goes through. And as you can imagine, then when you go like that, it can create little fragments that break off. Now initially, that doesn't necessarily cause any pain. It's actually the process when we get to more around this area, the red side of it is where you get bony spurs, okay? Now, some of you may know what that means, but long story short, the cartilage wears away, it reveals bone on bone, and when that bone on bone builds friction, your body tries to repair itself. And by doing that, it lays down more and more and more bone, and you get more like a corrugated edge. They rub, creates friction, friction creates inflammation, inflammation, ow, my knee hurts, okay? So, wear and tear, that process, as I just said, doesn't mean you have to have pain, okay? Some people have arthritic joints all over the place with no pain. Now, this is a story of, it is anonymous, okay, Mr. MNE. He was a patient that I saw probably 10 years ago now. He came into my clinic and he walked in, both knees bent like that, he couldn't straighten up. His legs were like so, and his legs were bowed like you wouldn't believe. And as he walked in, I thought, oh my God, I've never seen knees like it. I thought, poor guy. Sorry?
Lack of vitamin D.
Well, correct, that is rickets. That normally happens in younger people, but yeah, you had it right, that bone. No, that was what was actually happening to his joints was they were collapsing on the inside, and they were moving outwards like that, hence creating the bone. It wasn't a bend in the bone, it was the joint moving. And he walked in, and I thought, oh, this poor guy, what are we going to do with him? Anyway, he laid down, and we didn't really talk, and I said, okay, let's have a look at you. He laid on, and I asked him, I said, could you take your trousers off so I could have a proper look at your knees? And he looked at me really weirdly, and I thought, that's a bit not thirsty. Anyway, so I got on the couch and I talked, had a feel around. I said, okay, so we're going to need to do something about these knees because I think they're slightly beyond what I can help you with. We're going through this process, and at the end he said, yeah, that was all lovely, and actually my knees feel okay, but I actually came from my shoulder. So the point is, after long discussions with him afterwards, we did sort his shoulder out, by the way, he didn't actually have any problems with his knees. And physically and objectively, from my point of view, they were the worst knees I've ever seen. However, he was a farmer. He'd been a farmer all his life, jumping off tractors and everything like that. And he had no issues with his knees. He's an absolutely lovely guy. And he was very forgiving of my horrible mistake. But the point is just because your joints necessarily look bad, he had no inflammatory response because how strong all his muscles were. His muscles were so strong for years and years and years of working that he didn't actually need anything to do with his knees, and he was perfectly happy with the way they were. Okay? Long story short, I think he did have a knee replacement about 5 years later, but that was because it started, but at the time it didn't. So, a little story there for you to talk to you about. It doesn't necessarily mean you have to be in pain. Misconceptions. So, there's lots of things with this, and this is all relative, and there's a few little stars on there that you can see, and I'll discuss them in a bit more. But generally speaking, number one, exercise will make it worse. Incorrect. Exercise may make it a little bit more uncomfortable in the short term. However, the actual, like I said, it's about the inflammatory process. There's lots of different activities that you can do that don't inflame the joints. You're very lucky for a beautiful pool here. Water, low impact on the joints, can strengthen the muscles. I know you were talking about aerobics class, but better, weren't you? The aqua aerobics, fantastic thing to do. CT classes, stuff like that, low impact, that is brilliant. I need to rest because of my joint. When you rest your joints, what tends to happen is that lubrication, that WD-40 effect I stated on the joints where they lubricate really nicely, it dries up, and actually your cartilage pad becomes even more brittle. So the key is, I call it snack exercise. Okay, so as you snack, the same thing, little and often. Keep that joint moving, keep the mobility going. There's nothing they can do. I'm sure some of you may have heard that from a medic or two about a knee, a back, or whatever. There's nothing we can do anymore. It's just the way it is. There's always something you can do, okay? And what that often means when there's nothing they can do, that means there's nothing they can do to fix it, but managing it is a very different story, okay? I have to get used to the pain. Incorrect again. So pain is there. Yes, we all wake up. I mean, I do as well in the morning, feeling a bit sore and stiff. There is lots of things you can do to manage that pain. There is anything from acupuncture, which is incredibly good at managing any kind of chronic problems like arthritis. There's exercise again, as I spoke, and even pain relief. You know, that is something that everyone has a different take on, but correctly managed pain relief can be really beneficial. Pain relief doesn't help. I hear a lot of people say, I took 2 tablets and it didn't help it, so I stopped taking it. Medication is important, and there are some medications that you shouldn't be on long term. However, proper discussion about why your knee is hurting. So it's not only the pain, but does it swell up a lot? Does it get stiff? Is it actually the fact that that joint is not stable anymore? What is the reason for your pain? So anything from that point of view, if you need that, we're always here to have a chat about that, because different types of medications have different things. I'm sure you've all been on, if you have taken, including all different sorts of things over time. The last one, I've heard this a few times, not necessarily here, and some people may find it funny, but arthritis has spread to my other joints. It's not a systemic issue. It's not like a diabetic issue or anything like that. It's specific to that joint. You cannot catch it. It's not like the flu. You cannot catch it from one knee to the other. So just because you've got arthritis in one knee doesn't mean that that's definitely what's happening with the pain in the other. So that's just something to bear in mind. Some lovely photos here for you as well. So if they're a bit graphic, we can show the breakfast. But this is an X-ray of the knee. Okay, like I said, I use knee again because it's a nice big joint. This is what your knee should look like. Okay, when you're, well, to be honest, wear and tear starts very early, but that's probably a 20-year-old knee. Nice big joint space. You can see that the dark bit is where the cartilage would sit, and this is an arthritic. You can see how the white in the bone means increased density of bone. We spoke about those bony spurs building up. That's what that is. So you lose height on the knee joints, and that's where you can see. You can imagine why you get a little bit of friction in there. That's a 3D model of one. Okay, so as you can see, that's moving away, and this is a knee replacement. Okay, so this is how they replace your knee. So they basically take the cartilage bits and put metal plastic in there. Okay, I always say with knee replacements as well, they're a common misconception that they solve all problems with knees, but it's like replacing your Ferrari with a Mini. They're good, it'll get you from A to B, but it won't be able to get you to 0 to 230 seconds or whatever a Ferrari can take. Right? So, best way to manage this. I've spoken a lot about exercise already, but this is the process. So this is laid out, this is a guideline laid out by the National Institute of Medicine. And we always work this in any problem that we deal with. We work at least invasive to most invasive. So obviously, you don't go, my knee hurts, and they start sticking a knife in it. They don't do that. They try and make sure we can avoid all of that because of all the risks that come with it. So the first one, very simply, exercise. One thing I would add is people go, my knee hurts when I exercise. That is because you're not doing the correct exercises. Okay, you do not have to be in pain when you're doing your exercises. So specific exercises that have been prescribed to assist your pain. So this requires assessment, what's weak, what's strong, what's tight, what's loose, etc., etc. Okay? And that's what we spoke about, snack exercise. Manual therapy and exercise. Now a lot of people, we find that the pain within the joint isn't actually coming from the joint, it's the muscles in the area. Okay? They end up into a sort of a guarding pattern where they start contracting, holding your knee. Those muscles get tired and they create pain. Muscle is the most painful structure in the body because of all the blood vessels in it. Okay? So sometimes a little bit of hands-on, relaxing the muscles off along with the exercise, it can allow you to exercise more freely and you get more benefit out of it. Okay? So that's something to think about. Third option, as you can see, I'm just adding on to these here, pain relief with the hands-on and everything. So sometimes that manual therapy exercise approach doesn't work. It doesn't. And you might find you require pain relief alongside it to assist with that. It doesn't mean you have to be on it forever. A short-term period, maybe 2 weeks, 3 weeks, something like that, through that process to get you moving. Once you're moving, you then wean yourself back off it and things become a lot easier. Because I know, like yourself, I can't even take ibuprofen. I'm useless, I can't take anything strong. So I know there's a lot of people out there much prefer not to take things than take things. Okay? Injections. Now, I'm sure some of you, anyone had a steroid injection? Couple. So yeah, they are not the most pleasant things in the world, but again, that can help along with the other activities to assist. They generally go down the injection route, following a process of pain relief exercise, manual therapy approach that hasn't worked. Okay, and finally surgery. That's how we fix it as well. So if the joint gets to a stage where it's just not working, the exercise can get too painful, etc., etc., then surgery can be an option. But as I said before, it's a big process. Any kind of joint replacement generally takes full recovery as a year, and it takes a hell of a lot to go through that process. So my advice, try and get above it. Okay, make sure that the following two aren't your first port of call. Okay. So we talk a bit about diet. There's lots of things that they say do and don't. This is I've pulled this straight out of medical journals. Okay, so this is what they say helps and doesn't help. So food, I mean, it's pretty straightforward. Low fat, avoid your sugar, eat healthily. Okay, because you need vitamins, vitamin D. Someone mentioned lack of vitamin D earlier. Vitamin D, calcium, really, really important for bone structure. Healthy oils, so making sure we're not deep frying stuff in vegetable oil and other things like that. Olive oil to go on salads, coconut and avocado oil to cook with. They're generally the best ones I tend to go for. These are very, very, very underrated. Okay, so ginger, turmeric, curcumin. Okay, I'll get that right. They're all very anti-inflammatory, and very simply, having turmeric capsule once a day can significantly reduce your inflammation within your knees. I've seen it work absolute miracles for people. I take it every day. Do you take it every day? Turmeric, sorry, I should say. I keep saying it. Yeah, you don't. It's really, really good. I've had a knee problem myself, and I tell you, it made a massive, massive difference to me. So those little things you can add in. As you're probably working out here, there is no one way to fix this. There is no magic pill for it. There is not this works. It's a way of making everything in your lifestyle slightly better in every dimension. Okay. Now I'm not saying by reading this saying you can never have fish and chips again or whatever, but it's about moderation. Okay. So most of the time you shouldn't be eating stuff like this. So as I said here, highly processed stuff, too much sugar, too much fat. The unhealthy fats we're talking about, okay, so there's what we call trans fatty acids, which is basically the stuff that you buy that is pre-made. Sometimes ready-meal stuff can be quite high and things like that, depends what you're eating. But just keep an eye out. On the front of the box, they have their red, yellow traffic light system. The saturated fats, if that one's red, maybe pick up one that's yellow instead, basically. Drinks, you can have ginger teas, tamarind teas, everything like that, they're really good. And the main one is stay hydrated. Water is that cartilage procedure I told you about, 80% of a cartilage tissue is water. So if there's not enough water in your system, it's going to be affected. Okay? Hydration is a real key of enabling all of that. Lovely. So, we've done a lot of talking, I've done a lot of talking. That concludes our little chat for today. I'm willing to take any questions. If anyone wants to talk to me in person, I'll be up there. Vix, if you've got anything to